What is the most common gynecologic malignancy? Endometrial cancer explained. A Q&A guide for medical students, nursing students, healthcare students. Essential knowledge for future healthcare professionals. Question: what is the most common gynecologic cancer, and what part of the uterus does it affect? Answer: endometrial cancer is the most common gynecologic cancer, affecting the inner lining of the uterus called the endometrium. Question: what are the histological subtypes of endometrial cancer, and which one is more common? Answer: the two main histological subtypes are endometrioid and serous carcinoma, with endometrioid being more common and accounting for about 80% of cases. Question: how do unopposed estrogen and obesity contribute to endometrial cancer? Answer: unopposed estrogen stimulates the endometrial lining, leading to hyperplasia and possibly malignancy. Obesity can lead to excess estrogen production, further increasing the risk. Question: what diagnostic modalities are used to evaluate abnormal uterine bleeding in suspected endometrial cancer? Answer: diagnostic modalities include transvaginal ultrasound, hysteroscopy, and endometrial biopsy. Question: describe the staging system for endometrial cancer. Answer: the FIGO system stages endometrial cancer from 1 to 4 based on the extent of tumor invasion and spread to lymph nodes and distant organs. Question: what surgical procedure is commonly performed in the treatment of endometrial cancer? Answer: a total hysterectomy with bilateral salpingo-oophorectomy is commonly performed, often along with lymph node dissection. Question: how does radiation therapy fit into the treatment of endometrial cancer? Answer: radiation therapy may be used postoperatively, as primary therapy for those unable to undergo surgery, or palliatively for symptom management. Question: how does Lynch syndrome relate to endometrial cancer? Answer: Lynch syndrome is a genetic condition that increases the risk of endometrial cancer, as well as other cancers like colorectal cancer. Question: what are the common signs and symptoms of advanced endometrial cancer? Answer: signs and symptoms may include pelvic pain, weight loss, bloating, changes in bowel or bladder habits, and metastatic symptoms such as jaundice or bone pain. Question: how does endometrial hyperplasia relate to endometrial cancer? Answer: endometrial hyperplasia is a precancerous condition characterized by the thickening of the endometrium. Certain types, especially with atypia, may progress to endometrial cancer. Question: what follow-up and surveillance are recommended for patients treated for endometrial cancer? Answer: follow-up usually includes regular physical and pelvic examinations, imaging as needed, and patient education to recognize signs of recurrence. For comprehensive information about endometrial cancer, including symptoms, diagnosis, treatments, and research, medical students, nursing students, healthcare professionals, and others interested in this subject are encouraged to explore authoritative medical sources online. Reputable websites such as the American Cancer Society, the National Cancer Institute, World Health Organization, WHO, and prominent medical university websites are excellent starting points for accurate, up-to-date information about the most common gynecologic cancer.